I'm Roberta Bivens, and I'm a historian here at the University of Warwick. For the last 5 years, I've been part of a team of historians studying the cultural history of the National Health Service. We've been looking at how it's been a part of our lives since it opened its doors on the 5th of July in 1948, and how it's permeated every aspect of British culture, from high to low, from what we see on stage and in the movie theaters and on television, to the way we live our lives right here at home. Of course, with COVID and with the messages we've been receiving and following to stay home to save the NHS, it's become even more pertinent. And I think all of us are probably thinking about the National Health Service a little more actively and a little more intently than perhaps we did at other times. One of the things that we found in our research over the last 5 years is that when people are thinking of the health service, of course, they often think of the hospital service. In fact, it was a joke early in the NHS that the National Health Service was a national hospital service because it was so intently focused in those war-ravaged days in rebuilding the capacity for hospital medicine and increasing the ability of the hospitals to cope with suddenly an enormous influx of patients with desperate, long-standing medical needs that they'd never been able to get treated before. So it's not surprising. In fact, 70% or so of the NHS budget is still spent in hospital care. But most of the care we receive from the NHS, and this is something that I found really interesting, perhaps as much as 90% of it isn't delivered in the hospitals. It's delivered on the high street with NHS dentists and opticians providing NHS services like eye checks. It's provided, of course, by our general practitioners. These are the men and women who are giving us the daily care, but also, and I think this is what I'm going to focus on today, they're giving us the tools we need to care for ourselves. Now, during COVID, a lot of attention has been brought to the kinds of responsibilities that we have to take as citizens and residents of the UK, and as people who are entitled to use the NHS, but who also need to protect it from undue use while it copes with this COVID epidemic. And we've been given a lot of messages of washing our hands, being careful to cough into our elbows, lots of things, little tips about everyday behavior. And it may seem a bit new for us to be receiving such messages so insistently from the state. But in fact, this is something the NHS has done from its very inception. It's talked about how we should wash our vegetables. It's talked about how we should cook them. I've seen health safety messages from the 50s and 60s about how to wash kitchen implements to make sure that you are keeping them safe and sterile, that you're able to use them safely in cooking, how to store your food. All of these messages have been put out in order to promote our health, but they ask us to do that work and they ask us to do it at home. And of course, the most famous message of all, the one we're hearing of course today, is please wash your hands. This has been a constant trope in the NHS, and if you were around in the 40s, late 40s, the 50s, the 60s, the 70s, you'll probably remember hand-washing campaigns even then. Of course, they're especially important when we see campaigns around epidemic disease, but every day we're encouraged. Perhaps you'll have seen messages in the toilets at work. You may have seen them at other times when the NHS was facing the seasonal flu crisis. Washing our hands is important, but it's a home behavior, and we have to do it here. And so I thought, as we're all locked down and staying in to protect the NHS, it might be worth looking to see whether we can find traces of this health service at home in our own homes today. So I had a little rummage. Now, it's not going to surprise you to hear that most of what I found in my house, and there's plenty of it, was paper. You'll see in this pile my health results. I'm a middle-aged lady. I have a health check, and it helps me. It gives me advice on how to promote my health for this period of my life, to tell me if I am healthy and how I can stay that way. I had physiotherapy. That's from the NHS. I have surgeon's appointments. I have eye prescriptions. I'm quite lucky, an NHS dentist as well. So this blizzard of paper is something that perhaps reminds us of how we interact with the NHS. But I think it's worth looking at it. And when you look at it more closely, often what you see is advice for you to act on you're providing healthcare to yourself in the home. And the home has remained an incredibly important site for health preservation and well-being all the way through the history of the NHS, just as it was in the centuries beforehand. Now, as well as this kind of generic stuff that I'm sure all of you will find in your house as well, and that works to remind us of the way that a universal service free at the point of need isn't just an entitlement but a responsibility, and has been for the entire 70-odd years of the National Health Service's history in Britain, I found some other objects that were very meaningful to me, but that also helped me to think about the history of the NHS. So this is the first one. This is my first NHS card. Now, as you may have guessed from my voice, I've come to Britain from the United States. And I was astonished, to be honest, when I first came here. I didn't really believe that as someone who had just entered the country, I was entitled to National Health Service care. And in fact, for my first couple of years here, I didn't register for a GP because I just couldn't believe I was eligible. So this NHS card is something that I treasure and I have kept since I first came here. It says, please keep this in a safe place. It's proof you're entitled to NHS treatment. The idea of growing up somewhere where health service is a right, where it is part of your residency in the community, and it's something that you do for yourself and that the community does for you, may seem to those of you who were born in the NHS a very average thing. But to those of us coming to Britain from the rest of the world, it's a striking marker of a very long-term historical development of the gradual, but in some ways unstoppable movement of the state into provision of services for its citizens. And the idea that a healthy state depends on healthy citizens is at the bottom of this vision. In 1948, it took on the new character of also thinking that this is about how to create an equal and a just society. And I think that a lot of us believe this just as strongly today as Bevan and the Socialist Medical Association, for example, believed at the time. Now, another thing that struck me and that I found around the house is another NHS health card. This one's not mine. This is the health card of someone who was born in the NHS. And if you look at your own birth certificate, which I'm sure you may have one around the house, you'll see that it actually includes an NHS number at the bottom. Even though the certificate's not supplied by the NHS, that's one of the most important identifiers on it. Now, what I found very striking looking at this health card, which is from my wife, who was born in East London some time ago, is that unlike my card, which tells me to keep it in a safe place, hers tells her that she's to bring it with her, that it's important that she should carry it, take it with you when you visit the doctor, or go for dental treatment, or take an eye test. It was a different vision of the NHS. It was a vision in which we identified ourselves. It was important to show that you are entitled to this kind of treatment. And one of the questions this raises for me is what changed between these two periods? What did we change and what did it mean about our society? And these objects that we see at home, they can really help us to start unpicking how a service that we all think of in some ways as being very stable, as being almost unchanging, the National Health Service, free at the point of delivery, etc., has actually always been changing and always been responding to different circumstances. The advice around your NHS card was different in the 60s and 70s than it is today. And it will change again. The rise of things like the NHS fee, the NHS surcharge that people have to pay now when they come to live in Britain, shows that our attitudes towards the universal provision of healthcare to all legal residents in Britain is something that's under threat. And it's something that we can think about. As well as these kinds of key objects about all of us, that probably all of us have somewhere, I found a few unique and special things that are very meaningful to me and that also relate very closely to the history of the NHS. And I thought I'd show you these two pins as an example. One of them is the 70th anniversary of Windrush, the ship that brought Caribbean migrants to Britain in order, in part, to work on new social services that began in the late 1940s. Now, Windrush arrived in 1948, about a month before the NHS opened. It's a coincidence, but it's not unconnected. In fact, Britain was a country of enormous migration at that point in time. Obviously, we needed workers to help us with the after effects of the war. And we also needed many, many more workers to provide the vast range of social services that had suddenly become available in the new, more egalitarian society that was rising from those World War II ashes. That was something that was absolutely fundamental to the NHS, and of course remains absolutely fundamental to the NHS today. So in some ways, those two little pins remind me of a really crucial part of the history of the NHS in our culture, that it is a history of migration as well as a history of health. Now, another odd thing I found around the house was this. You say what it is. It's a bookmark, and it's a charity bookmark that was made in order to raise money for an NHS hospital. Now, we may not think of that, and in fact, Nye Bevan in 1948 was adamant that NHS hospitals shouldn't be about charity anymore, that no one should feel that they were receiving charity when they were receiving health care. But of course, as you know, and as Captain, now Colonel Tom's work has shown us, charitable giving has remained a fundamental part of national health services. And some of my colleagues on this project, George Gosling, for example, have been working very hard to uncover the history of charity, the persistent history of charity in the National Health Service. So even the little odds and sods that we bring home are hooked into that history of the NHS. Now, it's worth thinking about the fact that this isn't new. In fact, the idea that the home is a space where our healthcare functions and where we provide ourselves with care has, as I've said, been a fundamental part of the history of health and the history of the home for as long as people have been writing about those subjects. It's important for us now because as we're taking care of ourselves in the home and as we're protecting the NHS in the home, it's a site where we can think about and reflect on what we need if we want to continue having a national health service that is free, that's universally accessible, that we pay for out of taxation rather than privately. I think these are key aspects of the cultural history of the NHS and something that we would love to hear more about from you. If you're interested, if you've looked around your house and found that you have taken the NHS home, and I've seen some very, very sorry collections of crutches in people's closets, so you won't be alone if you find those in your house. Then get in touch with us here at the people'shistoryofthenhs.org. We'd be delighted to hear from you. Thanks, and keep safe.